Hey everyone, Dr. Matthew Hernandez with Ethos Integrative Medicine, and today we're going to talk about 6 things that you should be talking to your doctor about when it comes to your joint pain. So the scenario that we have here is the doctor got a diagnosis, they figured out what treatment we should be doing, they explained everything to you, and what we don't want to do is to leave a patient uneducated on the treatment that we're doing itself, right? So patients not being educated on the treatment itself can accidentally do something that stops the treatment from working. They don't have an expectation of when they can start going back to activity, a number of different things. And so the things that we want to be paying attention to are, number one, what is your lifestyle activity? So what are the things that you do in your life that you need to be able to continue to do, or that are being affected by your joint pain specifically? So if you have back pain and you're having trouble picking up your grandkid, that's important for us to know. Those types of activities are going to be things that we need to build a treatment plan around, and we need to take those things into account in your case. So what's your lifestyle activity? Are you an active individual? Maybe you're not someone that's overly active. You just go for walks in the morning or in the afternoon. And how we go about approaching a patient that just does walking versus one that does weight training and strength training is going to be completely different. So we need to understand that. That takes us to number 2, which is, what's the goal of what you're wanting to accomplish here? And this is something that doesn't often get asked in doctor's offices. So is your goal to just get out of pain, or is it to get out of pain and stay active? Is it to return to sport? There's a number of things here, right? And oftentimes doctors don't ask that question because they believe it's like implied, but going and assuming something about a patient really misses the boat on being able to understand what the patient is wanting and understanding the expectations that the patient has. So understanding what their goal is also really important to building a treatment plan. When I have a patient who isn't very active and all they care about is getting out of pain, and they don't weight train, they don't do anything like that, they just want to get out of pain, that's different again from someone that hikes 20 miles every day or does weight training, and they want to get back to being able to be active and continuing to do that. So those are 2 different ways to treat people, and understanding those goals is really going to help me as a physician identify what I need to be doing for this patient. The third thing we're going to look at is a treatment timeline. So this is really important for patients because there's oftentimes, especially in the regenerative medicine world, where we can go and do a treatment and the patient thinks, okay, automatically I got my injection, I got treated, in 2 days, I'm going to feel great and I'm going to go back out to go and work out and do all the things I was doing before. And then when that doesn't happen, then they end up being upset by it, right? And so setting that expectation up front of what's the timeline that we're looking at to address this problem is going to be really important. When we're talking about regenerative medicine specifically, this is prolotherapy, PRP, stem cell, those types of things. What those treatments are doing is healing tissue, and tissue takes several weeks, if not months, to heal. And so we really need to understand that, because if we go and put too much tension on the tissue before it's ready to take it, we're only going to slow the healing process down. And so going and really saying, okay, this is going to be a 3-month process that we're going to be going through. By week 4, week 6, you'll be able to start doing a lot of the activities you want to be doing, just at a slower pace or with less weight, with less reps, whatever it is. And so that's going to be really important from a treatment timeline, is setting that expectation. Psychologically, knowing that timeline is often more beneficial than it is detrimental to the patient. If I don't give patients an expected timeline, then they're left wondering, right? And wondering, when can I start this? When can I start this? And some of them just will go and do it. And again, that can slow the process down. So understanding the timeline is really important. The 4th thing is what you can and can't do from an activity standpoint. So An example of this is if I have someone that loves to hike, and they still want to be able to do it. There's instances where I'll tell the patient, hey, you can still go hiking. I just need you to not go on any rugged trails because of your injury. I like to take a smooth trail, one where you're going to minimize the chance of you falling or tripping, stuff like that. For the patient, that really allows them to be able to continue doing the things that they love. Sure, it may not be at the intensity that they were doing before, but that'll come with time. And so going in and explaining what they can and can't do is going to be important. If you have someone that, I have patients who have like low back pain or knee pain and they weight train. It's like, hey, you can still weight train, just do your upper body for the next 2-4 weeks. We're going to continue checking in, and I'll let you know when you can start doing specific things. The other thing that we need to be discussing with this one is what can you do that's modified, right? So if we can modify a lift to take pressure off of a specific muscle or a tendon or a joint itself, this will actually allow the patient to continue all the activity that they're doing and just making minor modifications to their workout routines. So that's going to be a really important conversation to be having with your physician. The fifth one is going to be what can stop the treatment from working. So I've had several instances where we have a patient who I have the conversation of, hey, if we're doing this regenerative medicine treatment, I need you to avoid these medications because they're going to negate the treatment, they're going to stop the healing process. And we obviously don't want that to happen, right? We want to continue the healing process, let the patient get better. And so having that conversation really helps decrease the chance of them doing something that's going to stop the treatment from working. Still, there's times where I'll have that conversation and the patient forgets, and they end up taking a steroid dose pack because they got a cold or something, and that completely negates their PRP or their prolotherapy, stem cell, whatever we did. It's hard for us to tell as the physicians where was it the treatment itself or was it that you did the steroid pack? Well, most of the time it's going to be that they did the steroid pack. If that's a variable in there, right? We want to control as many variables as we can here. So understanding what's going to stop the treatment from working is going to be really important from that perspective. And then the last thing that your doctor should be talking to you about is what are the things that are going to stack the odds in your favor for your treatment to work, right? So what are the things that you should be doing from a regenerative medicine standpoint? Things that we need to be taking into consideration as doctors are the patient's overall health status, what's their hormone levels, what does their nutrition look like, can we do, again, modified activities to help rebuild the tissue that we're working on? Is there any supplements we could be doing, any peptides we could be doing? Those are all things that can really stack the odds in the patient's favor to get them better faster and to get a better outcome from what we're going for. So again, those are 6 things that you should be talking to your doctor about when you're going over different treatments. That way you can get the best outcome possible.